Now, for many women, endometriosis is more than just painful periods. It can mean years of unanswered questions, of challenges with fertility, and navigating a healthcare system that doesn't always recognize the condition quickly enough. Joining us tonight is someone who deeply is committed to changing that reality for very many women. This is Dr. Fatima Kathrada joining us, who is a pharmacist, a researcher and lecturer in the Department of Pharmacy and Pharmacology at the University of Witwatersrand. Her work focuses on women's health and reproductive health, particularly on endometriosis, a condition she also advocates for through public education and research. Doctor, thank you so much for joining us. Welcome to African Diaries.
Hi, thanks so much for having me. I'm thrilled to be here.
Let's just start off by giving definition for those who are saying, first time I'm hearing this condition, and that can be shocking. But there are people, and this is both men and women, who are not familiar with what endometriosis is. What is it and how does it affect women?
Sure. In a nutshell, I think, basically, endometriosis is tissue that's very similar to the tissue that you would find in your uterus, the lining your uterus. Not exactly the same, but similar tissue. And it's a very sneaky disease. This tissue then grows outside the uterus, and it knows no bounds because it really can affect almost every organ. So although in the past it was very much classed as a gynecological condition, we know now that it's more than just a gynecological condition and it's really a full body condition. And it really has significant impact in the lives of women. It's quite a debilitating condition that causes quite severe pain, can affect fertility. And up until now, we still don't have any cure for endometriosis.
Doctor, I was of the belief that it is a gynecological issue as well. So explain to me, what do you mean when you say it can affect the whole body? What does that look like?
So, primarily if we think about a condition that just affects your reproductive organs, just your ovaries or your uterus or your fallopian tubes, where this endometriosis tissue is there's this tissue that grows outside of the uterus. It can affect almost any organ system. When I say any organ system, it can grow onto your bowels, it can grow onto your kidneys, it can grow onto your lungs. And that's why we see the type of broad, multifaceted symptoms that we see with these patients, because it really isn't confined to just the pelvis. And we've had cases where, a woman would be bleeding from the eye with every cycle because there may have been that tissue growing on the eye. So it really can affect every organ system.
Doctor, I think, and I'm saying this because I am stunned at what it is you are telling me. What are some of these side effects, these symptoms that you talk of? You just said someone bleeding from their eye. Where else can you bleed from?
Yeah, so I think it very much depends on where these lesions are located, and it differs from woman to woman. So, for example, this tissue that may grow into the bowels, they may present with gastrointestinal, your bowel type symptoms. Those that grow in the kidney, you may have urinary symptoms. So it depends on the organ system that it grows on. And in addition to the pelvic pain and the painful menstrual bleeding, or the pain during your menstrual bleeding, there's a whole host of symptoms that involve the different organ systems. So some patients may have this cough when they're on their cycle with an associated shoulder pain, and that may very much be due to this endometriosis on the lungs and that type of tissue.
Doctor, we are talking about symptoms that can be found anywhere in the body. I wonder what the diagnosis process will be. And so we're going to talk about that in just a short bit. If you've just joined us, we are currently in conversation with Dr. Fatima Kathrada, who is a pharmacist, a researcher, and lecturer in the Department of Pharmacy and Pharmacology, at the University of Wits. And we are talking all things endometriosis. If you have questions and you want to send them through, do find us on WhatsApp. There's much to unpack with the subject matter. Moreover, March is Endometriosis Awareness Month. And so take the time to read up, to familiarize yourself with information concerning this particular plague. Find us on WhatsApp, +2783 288 6684. 20 minutes before 11 p.m. Central Africa time, we are still in conversation with Dr. Fatima Kathrada, who joins us. She is a pharmacist, a researcher, and lecturer in the Department of Pharmacy and Pharmacology at the University of Witwatersrand. I think today I am being tongue-tied by everything. The month of March is Endometriosis Awareness Month, and we're here to discuss that. Dr. Fatima, we left off the conversation with you giving us symptoms that can be diagnosed everywhere in the body, from bleeding eyes to misdiagnosis with your kidneys to misdiagnosis with your lungs. How do you detect that this is indeed endometriosis?
So currently, the standard or the way in which we can really diagnose it specifically and confirm it is only by a surgical procedure called a laparoscopy, and usually a biopsy of the tissues taken to confirm by histology of whether or not it's actually endometriosis tissue. So it is an invasive procedure, and currently that is the only way we can 100% confirm a diagnosis of endometriosis. We are still, there is imaging that can be done, and there's a lot more expertise now using things like imaging. But again, we need a lot more training and specialists that are trained enough to be able to detect this disease via imaging. So currently, confirming a diagnosis usually involves an invasive procedure like laparoscopy.
Dr. Kathrada, I am looking at social media and we are all as stunned as can be, especially when it comes to the symptoms. For the woman who's listening right now, who's saying, okay, I understand that this can go beyond the womb, beyond my reproductive system. I suppose let's start off with ways to better take care of your body so that you don't end up with endometriosis. What are the things that we can do to keep ourselves healthy? Almost to say that if we do witness things and symptoms that don't make sense, we can be on the alert and say, okay, because I'm healthy, I know that I need to go and get checked up real quick.
Yeah, I think, the most important thing is we all know our bodies. And the moment you see that something is wrong, you need to seek medical care. And the moment you have, we've been told that menstrual pain is normal and you need to tough it out and deal with it. But I'm here to say that we need to move away from that type of thinking. And that is one of the reasons why we're sitting with a diagnostic delay of 7 to 10 years on a global scale. Really, the moment, if you have any type of debilitating pain that's related to your cycles in any way, or symptoms that you're not sure of, and if this pain is causing you to miss work, if this pain is causing you to miss days at school, if this pain is landing you up in the emergency room frequently, if you are passing out from this type of pain, it is not normal. And I want you to seek the medical care. Unfortunately, even in today's day and age, women are being gaslit, are being dismissed for this painful symptoms. So you know your symptoms and you need to push, whether it means getting a second opinion, a third opinion, a fourth opinion, until you are heard. and do not accept this is normal, you just have to deal with it, because it's not normal. And there are things that you can do, and there are ways in which you can manage this disease, even though there isn't a cure.
Let's talk about the treatment plan, Dr. Kathrada, for those who are well aware that they do have endometriosis. How do we treat this particular disease?
Okay, so like we said, there isn't a cure that would per se just treat you and it's done. It is a chronic condition. Surgery is one of the main ways in which we treat the condition via laparoscopic excision. Very importantly, though, is to take your time to make sure that you find a specialist that is trained in excision surgery. Okay, so endometriosis specialists. Remember that all gynecologists are not endometriosis specialists. Okay, and you want to minimize the number of surgeries you require, so you need one good surgery. Okay, so surgery is the number one. There are hormonal therapies that are also used to help manage the symptoms. So a lot of them are progesterone-based hormonal therapies, and what they do is basically they try to, it's an estrogen-dominant condition, so it tries to decrease and overcome that estrogen dominance, and in doing that, trying to slow down the progression, thinning the lining so that the menstrual bleeding is not as heavy, and all in all, decreasing the inflammation associated with disease, and thereby decreasing the pain and the bleeding associated with the disease.
Doctor, just as out of the questions that have just come through in actual fact, if you have had laparoscopic excision before and 6 months later or some months later, this particular disease grows back into that very space, how do you then navigate that? Because there are women who've gone through such an experience.
Yes. This disease is just a very clever disease. We've gotten to a point where we're saying it's not a cancer, but it behaves so much like a cancer, because yes, it can recur. Okay, and the recurrence rates really differ from one woman to the next. I can't tell you, no specialist can tell you that if you've had a surgery, it may recur within this period of time. It differs from individual to individual. But it is something that you'd have to sit with your specialist with based on what they found during your surgery. And usually immediately following surgery would then be the next line of treatment, which would be hormonal therapy to help control the progression and the painful symptoms.
I think lastly, Dr. Kathrada, as a parting shot to all women, I actually feel like we haven't understood how we contract this disease. Is it hereditary? Is it in our diet? Yes. How do we contract the disease?
So we're not sure. Yes, we are in 2026. This disease has been around for decades, and we're still not sure about the true etiology of the disease. The studies have shown that there is some link, genetic link to first-degree relatives. If your mother or your sister or your aunt suffered from endometriosis, you are at a higher risk of the disease. And this is areas where there is a lot more research that's gaining momentum. There's multiple theories into how the disease has come about, but the true etiology of the disease is still unknown.
And this is my very last question, Doctor. We spoke about fertility and it potentially affecting that. What does endometriosis mean for fertility generally?
So if you have to look at it broadly, it does affect fertility. It does make it a lot more difficult to fall pregnant. Okay, but it doesn't mean if you have a diagnosis of endometriosis that you will not be able to fall pregnant. There are many women that have fallen pregnant or conceived naturally. Remember, with endometriosis, it's so complex. There's inflammation, there's scarring, there's adhesions, there's anatomical changes within the pelvis. And all of this affects ovulation, it affects implantation, it affects the egg quality. And so it's a whole host of mechanisms. It's quite complex that really can affect fertility. And I mean, about 50% of infertile women actually have endometriosis, So it's important that once you have a diagnosis to already start working with your fertility specialist regarding your fertility goals, so that your treatment plans for endometriosis can really be met with your fertility goals and fertility outcomes. In many cases, patients will require further fertility treatments and assisted reproductive technologies to help them conceive. And like I said, it differs from woman to woman. It depends on multiple factors, the stage of disease that you have, if you have had previous surgeries, whether or not you have other underlying conditions. We speak about endometriosis, but then there's a condition called adenomyosis, which is very commonly linked to endometriosis, and many patients have both at the same time. And that's what we call usually the evil twin to endometriosis. And having those type of factors may increase the difficulty in falling pregnant. And on the other spectrum, if we just touch on it, we spoke about the symptoms. And on the other reproductive spectrum is endometriosis does cause a lot of pain on sexual intercourse. So also affecting fertility is that women that experience this pain on sexual intercourse, it affects relationships, decreasing the frequency in having sexual intercourse, and all that then affects fertility and outcomes in pregnancy in these patients.
I mean, doctor, we're not trying to be Debbie Downers, but this information does need to be spread. It really does. Thank you so much for joining us. I hope to speak to you soon, Dr. Fatima. This has been very insightful.
Thank you so much for having me, and I hope that we can really spread awareness about this disease so that we can decrease the delay.
Yeah. The voice there of Dr. Fatima Kathrada joining us this evening, pharmacist, researcher and lecturer in the Department of Pharmacy and Pharmacology at the University of Witwatersrand, joining us to speak on endometriosis because it is Endometriosis Awareness Month. I did not know that these symptoms can present themselves outside the frame of your reproductive system. That for me was something that I needed to take a moment to think on and go, wait, what is going on? Nevertheless, 7 minutes before the hour comes to an end and we'll delve straight into the second hour's contents. For now, let's get some music.